When a patient's first diagnosed with cancer, there is a very valuable window of opportunity that exists prior to cancer surgery.
Before I came, I was diagnosed in '09 with triple-negative breast cancer. I had a tumor under my arm in the lymph glands that started getting larger. It burst. The chemo did take the tumor down, and I was fine for a while, and then all of a sudden it came back.
I was supposed to do 6 months of chemotherapy. I have stage 3 colon cancer. I did 1.5 rounds, and in the middle of my second, I felt so sick, and I told myself I would never do this. I went online and looked for IV therapy that was holistic and actually found Dr. Mueller.
Patients can come here and actually do these therapies in conjunction with or in parallel with their conventional therapies, and in general what we've found is that these patients, they feel better, they do better, they have a much higher quality of life, and again, the overall outcomes are better.
So I started with him right away, and I started coming twice a week, getting all that therapy. Within 3 months, I had another PET scan and another brain MRI. And this time, everything was completely normal. The tumors in the lungs were completely gone.
We have one of the most complete integrative clinics in the area. We offer, again, some of the most advanced intravenous nutrient-based therapies for patients, for pain, for improving quality of life, for improving their appetite. Many of these things actually have very even direct effects that improve the outcomes in these cancer patients.
My quality of life has totally improved. I have more energy. I feel like I did when, like 20 years ago.
I don't have stomach aches, I sleep well. I wasn't sleeping well before either. And I feel great after a treatment. In fact, some days I feel so full of energy, I'm almost hyper.
We'd like to get patients in as soon as possible after the diagnosis, because I can put in place certain protections that involve, again, lifestyle changes, specific medications, and nutritionally based therapies, including the IV therapies that can help the patient at the time of surgery to avoid this spread and ultimately improve their long-term survival, which is based on the published literature.